In your Health Watch, the scars of cancer aren't just physical. There's an emotional healing you often don't see. Surgeons are relying on innovative technology that's helping women who undergo a mastectomy feel more like themselves after surgery. And it's even making a difference for women who've never had breast cancer.
It was actually a 4.3 centimeter tumor.
Sara Corley found the lump herself and found a doctor who listened.
And she said, yes, you have invasive carcinoma.
At 44, her thoughts immediately turned to her two boys. Her oldest is graduating in the spring.
Not knowing how serious it was, and afraid, was I going to make it to May?
Her treatment involved a double mastectomy.
Make an incision down here and take
Dr.
all
Allison
of the breast
DiPasquale,
tissue
a
off.
breast surgical oncologist at Texas Oncology, presented all options, including a nipple-sparing mastectomy using an innovative tool.
I want my patients to say, yes, I had cancer, I beat it, but I still look like myself.
She uses this portable device to help prevent complications like nipple necrosis. That happens when a lack of blood flow causes the tissue to die.
If that happens, it's extremely long recovery, risk of infection, removal of the implant, lots of different complications can occur.
Here's how the Stryker Spy technology works. A fluorescent dye is injected into a patient's bloodstream so surgeons can illuminate blood flow. That tells surgeons the tissue is alive.
With the technology, you're really getting hard, fast data.
But it's not just for breast cancer survivors. Dr. DiPasquale is seeing more young patients taking proactive measures because of genetic mutations that make them predisposed to breast cancer.
This now is allowing us to give us all their options up front. So let's take your risk of cancer remarkably down, and let's do it in a beautiful way.
Removing the tissue does result in loss of sensation. Sara later had implants placed.
And physically, I'm happy with how I look. It's the emotional healing that anybody that's gone through this journey knows is difficult.
She says this procedure is helping with the emotional scars.
Besides scars that I have underneath, I am still very much myself.
So obviously not everyone may be a candidate for this specific procedure, but Dr. DiPasquale's message is to ask about all of your options. Sara, who's a theater teacher, has returned to what matters, her students, her family, and we are happy to report her ultrasound this week confirmed that she remains cancer-free.